Hi, my name is Abby Barton. I did a Carotid Duplex ultrasound for my QA. It was on a 77-year-old male with previous history of hyperlipidemia, hypertension, and diabetes, all controlled with medicine. He was in a post-operative state from a left CEA from the previous report, which is what I'm doing my QA against or with. Also has a history of cerebrovascular disease. He came in to see me for his 6-month checkup. So the previous report that I looked up before going into doing his ultrasound was from February. It's listed in the interpretation summary from the previous sonographer, in the previous ultrasound, that there was a 50 to 69% diameter stenosis in the right ICA. However, the study data table doesn't show any velocities that exceed 125 centimeters per second, which would indicate a stenosis of 50 to 69%. They're all within normal limits. So I was a little bit curious as to why it was stated that there was evidence of a stenosis when there weren't any from the velocity criteria. It also says that the left carotid artery was imaged Doppler and appeared patent with no evidence of hemodynamically significant stenosis and antegrade bilateral vertebral artery flow. So, going in to do the patient's ultrasound, I was a little bit skeptical as to why the previous report said that there was stenosis but no velocity stating that. So I wanted to make sure that I really did my scanning correctly with the angles and overall gain, just the basics. I was working with Rachel Knightsky, one of the techs that I work with. Also, I was being overseen by Sandy Brown, which is our department head of our vascular sonographers. So when I did the ultrasound, I did actually get velocities that were indicating a 50 to 69% stenosis in the right proximal and mid ICA. I got a right ICA proximal velocity measurement of 154 over 45 centimeters per second, and then I also got a ICA mid of 136 over 43 centimeters per second, and then in the distal I got 83 over 32 centimeters per second, which is all textbook stenosis, which is kind of how it goes from a high velocity to way low in the distal. So however, I didn't find bilateral antegrade flow in the vertebral arteries. In the left vertebral artery, I had bidirectional flow. At first, I called it retrograde, but I called in Sandy to make sure that I was getting an accurate measurement of the velocity, and we obtained bidirectional flow, so there was flow above the baseline and below the baseline as well. I went over my pictures and typed up the report with Rachel after I was finished. So I filled out the template of the scan afterwards to the best of my ability, and then Rachel and I go over it together afterwards. So what the knowledge that I gained was I called it retrograde flow in the left vertebral artery when it's actually bidirectional, and I've never had to click that before. I've never seen bidirectional flow. It's either retrograde or antegrade typically. I'm really glad that I read the previous report, but I know sometimes going into a study where there's already a previous report written, a lot of times it's hard not to want to get the exact same thing that the previous report states, just because you don't want to be inaccurate and wrong, so you try to get exactly what the previous sonographer got. And so I tried really hard to steer away from that and just obtain the best picture and the best velocity that I could get. Also, the left ICA or the left ECA, sorry, was 130 over 14 centimeters per second, which I thought was stenotic, but it's not considered stenotic for the ECA unless it's 185 centimeters per second. So that was one thing that I had clicked on the template that was wrong, that Rachel and I went over also. So in our lab, we do QAs the second Tuesday and the fourth Tuesday of every month. And sometimes we'll have different reports of MRIs or CT scans compared to the ultrasound scans. And it's very rare that we use two ultrasound studies back to back. So this was one that I brought to Sandy's attention because of the previous report compared to what I had obtained. And so I think that we're actually going to use this study in an upcoming QA within our department, which is kind of exciting. I hope that I'll be there to state my points and kind of just ask where the previous sonographer had gotten. Maybe they obtained a velocity that was a 50 to 69% stenosis, but it didn't transfer over to our data table, so it could have been just an error of that. One thing that Sandy and Rachel both said was to make sure going into it that I had my angles correct. Like I said, that the color scale was set correctly, not showing any aliasing, that I obtained grayscale images if there was a stenosis and tried to measure the stenosis in long. Also to take a cine clip of the flow inside the stenotic part of the ICA. So those were things that I had to go outside of my protocol and obtain extra to make sure that I could really show that there was evidence of a stenosis. So the patient had a left CEA done previously, and that showed everything was clear and that the surgery was successful so far. So the right side is a little bit clogged up with some plaque. So hopefully it doesn't get any worse, but we'll continue to monitor him over time. With every 6 months, he'll come in and get an ultrasound done until the doctor orders differently. So I'm excited to see this taken to a QA with our head of vascular surgery, which is Dr. Eliason. So hopefully he can give his input also on the results. Thank you.